Hey guys, welcome back. This is Smart Media Facts. Here we talk about health and life. And today we are going to be talking about the causes of abdominal pain. In our last video, we've discussed what abdominal pain is and the 4 types of abdominal pain and what it signifies wherever the pain is located. Now let's talk about the causes of this abdominal pain. But before we go into details, if this is the first time coming across my channel, please don't forget to like, share and to comment, and don't forget to hit the subscription button and to turn on your notification bell so you don't miss out. And to my returning subscribers, this is me saying thank you and welcome back. So like I earlier said, today we're going to be talking about the causes of abdominal pain. Under these causes of abdominal pain, we have 2 causes. The first one is common causes and serious causes. But we have to first of all start with the common causes. What are the common causes? These common causes are just abdominal pain that comes and goes on its own, that it is just temporary. We just require either little or no medication for it to disappear. And examples of this common abdominal pain are: number 1, menstruation pain; number 2, digestion; number 3, temporary infection. Now let's move to the serious abdominal pain. The serious ones, these are the ones that requires serious medical attention. Mind you, abdominal pain can land you at the hospital as an emergency patient. So what are the examples of this serious abdominal pain? The first one is the right upper side. Like we discussed in our previous video, that the right upper side is the home to some organs such as the kidney, the liver, the gallbladder and the bile duct. So pain in this area is likely to indicate that 1, you have liver disease like liver cancer or hepatitis. The second one is that you have gallstones. The third one is that you have gallbladder disease like gallbladder inflammation or gallbladder cancer. We have the fourth one, which is the bile duct cancer, either bile duct stone or bile duct strictures. We have the fifth one, which is kidney infection. The seventh one is the duodenal ulcer, and the 8th one is the large bowel obstruction. Now we move to the second one, which is the upper left side. This upper left side is the home to our stomach, pancreas, spleen, and also our left kidney, which is at the back of the abdominal cavity, while our heart is above our lungs. So if you're experiencing pain in the upper left abdomen, it might be an indication that 1, you have bile reflux; 2, you have enlarged spleen; 3rd one is that you have inflamed pancreas; stomach ulcer, which is the 4th one; 5th one is that you have pancreatic cancer; 6th one is that you have kidney infection; 7th one is that you have kidney stone; while the 8th one is that you have gastritis. And when this pain is coming from the chest, it could be the cause of 1, non-cardiac chest pain; 2, heart attack; 3, heartburn; 4, pneumonia; 5, pulmonary embolism. These are the things it might indicate if the pain is coming from the chest. The third one is the lower abdomen. We know that the lower abdomen is where our small intestine and large intestine is, and pain around this area is likely to indicate that we are having gastrointestinal diseases, urethra, ovaries, or the uterus. It also indicates that we have the large or small bowel obstruction. The second one is that it might be either functional dysplasia. The third one is inflammatory bowel disease. The 4th one is hernia. The 5th one is colon cancer. The 6th one is kidney stone. And when it's coming from the pelvic organ, it might be in the pelvic inflammatory diseases. Second one is that it might be endometriosis. The third one is ovary cancer. The fourth one is uterine cancer. The fifth one is ectopic pregnancy. The sixth one is ovarian cyst. This can be the reason why one can have a pelvic pain. We have the fourth one, which is the left lower side. Pain on the left lower side might be related to diverticulosis or diverticulosis of the colon. One might ask, what is this diverticulosis we are talking about? Because we mentioned this diverticulosis under the types of abdominal pain. We once mentioned it there. This is the presence of small punches in the internal wall, which is often symptomatic. While diverticulosis occurs when one or more of these pouches becomes inflamed, infected, or causing symptoms like abdominal pain and absence or bleeding. And this can happen throughout the colon, but it normally happens in the lower left part. We have the fifth one, which is the last one, the right lower side. This right lower side, pain around the right lower side of the abdomen, may indicate that one is having appendix or appendix cancer. This is what the person might be battling with. That is the reason the person is having the right lower side abdominal pain. So this is all about the causes of abdominal pain. And please don't forget to like, share, comment. And if you have any question that you've been longing to ask, or you want to have any topic you want me to answer, please do well to drop it at the comment section. Bye for now. Love you all.